Well, it seems like allergy season will never end, but could those sniffles be just seasonal or something more? Dr. Arjuna Kuperan, a sinus specialist with Houston Advanced Nose and Sinus, is here to explain. Good morning to you.
Good morning.
Well, do a lot of people confuse the seasonal allergies with something more serious like sinus problems?
Absolutely. Allergies are incredibly common here in Houston, as you know. It starts in January with trees, goes into grass, and then ragweed takes you basically through the cold months.
Exactly.
So lots of people have allergies. Chronic sinus infections probably affect about 31 million people in the United States every year. So that's also very common.
So how do you know the difference between the seasonal allergies and these chronic sinus problems?
Sure. So some of the symptoms that you see with allergies that are very common: nasal congestion, clear mucus production, postnasal drip, sneezing, itchy, watery eyes. Those are really the classic allergy symptoms. Now, over time, those can morph into more serious symptoms that go into the symptoms that are more associated with sinus infections: facial pain, facial pressure, discolored yellow, green nasal drainage, severe headaches, loss of smell. Those are really the more hallmark features associated with the sinus infection.
I mean, the chronic sinusitis is a big deal. I mean, you said it affects millions of people. It can be a miserable situation. When do you know it's time to go to the doctor?
So the hard thing is, I can give you all these symptoms to kind of differentiate, but at the end of the day, someone that's a specialist in looking at sinus infections really needs to take a little camera, look in the nose, and see what's going on. And when you feel like your symptoms have tipped over and they're a little bit more severe than your usual allergy symptoms that I mentioned, that's probably the time to get it checked out.
So what kind of treatment is available now? Do you use antibiotics, or do you do something like this that we're looking at? And you can explain the video we're seeing here.
This is a balloon sinus dilation procedure. It's for someone who's got a chronic sinus infection, who's actually failed antibiotic treatment. And we usually try to treat people at least with 2 rounds of antibiotics, sometimes even 3, depending on how aggressively we've treated them. But this guide wire goes into the sinus, it inflates, and basically flushes out the infection. We usually use an antibiotic solution to flush out the infection and creates a permanent opening so that the sinus can then drain. But this is for someone who's really already been through some medical management already.
Right, and this would be a permanent effect then?
This solution has, in the literature, been studied and has good effects up to 5 years. They've seen that the patency of the openings made stays for that long.
So let's talk about other treatments as well. Are there some new options in treatment that you all have been looking at?
Sure. So for patients who have more significant sinus infections that are kind of beyond allergies, there's a really amazing new technology. It's called Propel. It's basically a steroid stent. And you can see it on the screen there. It's got little prongs on the end of it, and when you do sinus surgery on a patient with chronic infections, you can actually insert that stent into the opening that you've created, and it releases a steroid called mometasone, which is the same steroid that you get in those nasal steroid sprays like Flonase, and it dissolves it locally into the tissue for about 30 days. And that helps the sinus opening to stay open, patent, and helps to decrease the inflammation associated with the infection.
And this is FDA approved, just something you'd have to ask a doctor about. Does insurance cover it?
Insurance covers it, and it's something that not all doctors use, but it's something that's really kind of growing and becoming more widespread, but the literature really supports its use.
Well, very interesting. Well, thanks, doctor, so much for coming in. Hopefully you're going to get some relief soon, whether it be allergies or sinus problems, but we appreciate the information.
Thank you.
Thanks.